Question is, we're well aware of the success of the artificial sphincter, but we'd like to know what are the long-term complications and breakdown issues with the technology. Artificial sphincters have been around for upwards of 30 years now. It's a tried and true technology. It's actually very simple. It's essentially one valve and a pump that transfers fluid from one unit to another. The materials are generally very high-grade materials that don't leak. But with anything with moving parts, there is a breakdown rate. We jokingly refer to our patients that they have a 10-year warranty. There isn't specifically a manufacturer's warranty, but on average, these things will work flawlessly for 10 years without need for any kind of intervention or change. And the components can be swapped out if they break down over time. There are certain issues that have to be carefully considered with an artificial sphincter. If a catheter ever has to be placed in a patient with an artificial sphincter, let's say the patient's going for hip surgery and they're going to place a catheter prior to that, it's extremely important, and we in-service patients who have these sphincters carefully to advise them of this, but it's very important that the sphincter be deactivated, meaning that the cuff be deflated, all the fluids in the reservoir, and it be locked open like that for the duration of the time that they're going to be catheterized and require any chance of having a catheter. The reason for that is that the cuff does put pressure on the urethra, which is fine as long as there's nothing in the urethra. Once there's something in the urethra, you have that added pressure, and it's essentially adding to the ischemic time or reducing blood flow to the urethra in that specific area of the cuff, and that can lead to breakdown of the urethral mucosa. And it doesn't take very long for ischemic damage to happen. We can, see that within half an hour to an hour in some cases, but certainly after 4 hours of ischemic pressure in a sphincter that hasn't been deflated, I've seen erosions, and that leads to a whole mess of problems, including having to remove it. So those are the kind of things that we have to worry about, but that's really patient education after the fact to tell them what to troubleshoot for.